Stroke. Disclaimer: the information contained here should not be a substitute for the advice of a qualified licensed physician or other health providers. The information provided is for informational purposes only. Please check with your physician or healthcare provider with any questions or concerns. Strokes are the fifth leading cause of deaths in the United States and is the most common reason of adult disability. In 2017, 7 million Americans over 20 years of age self-reported having had a stroke. Those with higher stroke prevalence include older adults, African Americans, those with lower levels of education, and people living in the southeastern United States. What is a stroke? It is often referred to as a brain attack. It occurs when blood flow to the brain fails and can cause brain cells to die because of decreased blood flow and lack of oxygen. There are three kinds of stroke: those caused by a blockage of blood flow, those caused by bleeding into the brain, and transient ischemic accidents or TIA. TIA is caused by a temporary blockage of blood flow to the brain. It does not cause permanent damage but should not be ignored as it may signal a full-blown stroke is ahead. What are warning signs of a stroke? Warning signs are clues your body gives out that your brain is not receiving enough oxygen. For a stroke, act fast. Face: ask the person to smile. Does one side of the face droop? Arms: is one arm weak or numb? Ask the person to raise both arms. Does one arm drift downward? Speech: is speech slurred? Ask the person to repeat a simple sentence. Is it repeated correctly? Time: if you observe one or more of the signs of a stroke, act fast and call 911 right away. Other signs and symptoms of a stroke include severe headache, double vision, drowsiness, nausea, and vomiting. Warning signs may only last a few moments and it's easy to ignore them. Don't. Paying attention to them can save your life. Risk factors for a stroke include age, gender, race, family history of stroke, prior history of stroke, high blood pressure, heart disease, diabetes, high cholesterol, cigarette smoking, physical inactivity, and being overweight or obese. Your doctor can determine your risk factors. Many of these risk factors can be managed, but the risk is never zero at any age. You can prevent a stroke by recognizing and controlling your risk factors. Protect your most important asset, your brain. Be aware of your health and keep yourself safe.